Hi, my name is Shernel Ngiow, and this year I'm 17 years old from SMK St David, Melaka.
Hi Shernel, nice to meet you. I'm Yun Xin, currently a speech therapist working in the University of Malaya Medical Center.
So Yun Xin, I'm interested in becoming a speech therapist in the future, and may I know what inspired you to become a speech therapist yourself?
At first, when I got into this course, I know very little about this profession. So along my years of studies and years of training, where I get to see a lot of people who are in need, then I start to fall in love in this profession, where I know the purpose of serving and how I can help them. And I think this is what that is keeping me going in this profession.
That's good to hear.
Yeah.
So my next question is, what do you think I should study to become a speech therapist?
To become a speech therapist, you should graduate with a bachelor's degree in speech sciences program.
Okay.
So after your SPM, you should choose science stream in a pre-uni course. So in Malaysia, the government offered a few options for pre-uni courses, which are STPM, matriculation and foundation, which is Asasi. So for me myself, I studied STPM, so it's longer, it's a 2-year studies. So if you get into matriculation or Asasi, it will be shorter. Alright, so after you have gotten into the pre-U, you can choose the universities that you would like to study. But in Malaysia, currently there are only 3 universities offering this course, which are UKM, USM and IIUM. So there is no private uni in Malaysia offering this speech therapy program.
So I also would like to know what I should do after I graduate.
So once you have graduated with a bachelor's degree in the speech sciences program, you are qualified to work as a speech therapist. I think many others may not know this. Speech therapy is not just its literal meaning, giving therapy on speech. Okay, so when you talk about speech, it's about pronunciation, right? How accurate are your words? But we also give therapy in terms of language, where we have a child maybe at the 4-year-old can't really speak a full sentence, can only speak some simple words. So we help them to improve their talking part. Besides speech and language, we also see patients or individuals with swallowing problems. For example, if a patient has a stroke and it impairs the swallowing, so we also help to deal with this kind of patient. So speech therapy, we cover a wide area of population, from infant to children to adolescents to adults and even elderly.
So can you walk me through on your day-to-day life in the hospital as a speech therapist?
I work from Monday to Friday. There is no need to work during weekends.
Oh wow, that sounds really nice.
Yeah, so my working hour is from 8 to 5. So I started off my day by checking which patient I should see, whether it's in the ward or sometimes if I have outpatient where they come with appointment basis, then I will just stay in the treatment area. So after I see patients, I'll have to clock in notes so that the doctor can read my notes, what is the patient's progress. And on some days, I will have some continuous professional development, where this is some discussion among our colleagues, where we share with each other, update on each other on the latest effective way in helping patients, or we discuss about cases that are really hard to manage. Yep, basically that's about it.
Yeah, so do you do a lot of paperwork? Do you write reports for patients?
Yes, definitely. So we have to clock in every single notes so that we can keep track on the patient's progress. But apart from the patient's workload, we also deal with some admin work, but it is only according to season.
May I also know who needs speech therapy?
Well, individuals with, for example, autism, ADHD, hearing impaired children or hearing impaired adults, We see also stroke patients where they have problem with the eating and swallowing and talking. We see those with speech delay. We see those with speech sounds problem. Some maybe cleft lip and palate, and dementia patients. So we see quite a few populations.
But in this particular hospital, you only deal mainly with swallowing patients, right?
Yes. Mostly we see adult patients with swallowing and language problems.
So from your previous explanations, I learned that you deal with a wide range of special needs people. So what are the skill sets that a speech therapist needs to be successful in their career?
In my opinion, one should have a good communication skills.
Okay.
Besides that, you should also have good listening skills, be empathy, and have a strong clinical skills. Learn to be flexible and adaptive in your session. Most importantly, have fun.
Okay, that sounds like something I can work on. And for my last question, what are some of the challenges you face as a speech therapist?
To me, it's very high caseload because sometimes I'll need to see 10 to even 12 patients in a day.
Oh, wow.
So it's really very taxing.
Okay. So how do you overcome the stress caused by that?
I will have to work overtime, but working overtime doesn't mean that I'm very stressed on it, because at some part I find that helping people is actually something very rewarding, and it really adds meaning to my life. At the same time, I do enjoy seeing a lot of patients because it's really satisfying.
So you really love your work?
Yes, come join us, contribute to this profession.
I will. After this conversation with Yun Xin, I've learned that becoming a speech therapist definitely has its hurdles and challenges that I have to overcome. However, I think that is also part of life. I think that will be a great learning process for me, and I believe that if I have a positive attitude, I believe in myself and work hard, as well as do proper planning for my future pathway careers, I can become a successful speech therapist that is dedicated to her job and helps people live fulfilling lives.